An outbreak of Ebola in Central Africa has got global health officials worried. Hundreds of cases have been reported, along with more than 100 deaths. So what's behind the outbreak and how dangerous is it to the region and the world? What you're about to see is supplies being rushed to the front lines of the outbreak in the Democratic Republic of Congo. The World Health Organization is sending nearly 5 tonnes of medicine and equipment. Health workers are also en route. Now, the outbreak is centred on the western Ituri province in the DRC. Cases and deaths have also been reported in neighbouring Uganda. Officials fear the disease could soon spread further to Rwanda. Now, it's turning into something the international community is increasingly worried about. Here is what the UN is saying most recently.
You will have seen that yesterday, the World Health Organization said that the Ebola outbreak in the Democratic Republic of Congo and Uganda constitutes a public health emergency of international concern, highlighting the high risk of further spread and the likelihood that the outbreak may be larger than currently detected. The outbreak involves the Bundibugyo strain of the Ebola virus, for which there are currently no licensed vaccines or specific therapeutics.
Now, the DRC, it should be said, has seen outbreaks before. Eric Feigl-Ding can help us understand what makes this one different. He's an epidemiologist and chair of the Department of Public Health at the New England Complex Systems Institute think tank in the US. Eric, great to see you again. The mention of the name Ebola is enough to strike a certain amount of fear into anyone who remembers the Ebola outbreak of 2013 that killed more than 10,000 people. What worries you most about this current situation?
Yeah, happy to be back. Well, unhappy that it's about another Ebola outbreak. But I think this one is not the traditional Zaire strain, which we have vaccines and treatments for. This strain is a relatively very rare, different strain. And again, we don't have vaccine treatment, and it seems to be spreading faster based on our preliminary estimates than the previous Ebola strain. So all that combined, lack of vaccine, lack of established treatment, and seemingly a little more contagious in terms of speed is a little bit worrisome, because there's somehow we're having very high positivity among the cases that we've tested, and we haven't even tested that many at all. So the fact that it's already infected and killed at least 4 or 5 healthcare workers is also very worrisome, because that's almost like the tip of the iceberg. If it's already killing healthcare workers and it's spread to so many different regions already relatively quickly with very little testing, we're already finding so many, that means we're just scraping the top, and this outbreak is much wider than we thought. And in many ways, the coordination with the global, CDC is no longer coordinating with the WHO. USAID presence is non-existent anymore. They used to be able to find cases a lot faster. It also sets up a perfect storm that we're not dealing with this virus, and this epidemic may be bigger than we previously thought.
All right, I want to dig into all of that along the way. Let's, before we push on much further, take a look at what Ebola is, how it spread and what happens to those who are infected. Ebola is a rare but serious disease caused by a group of viruses. It is spread through contact with infected bodily fluids such as blood or vomit. After a person is infected, the first symptoms appear between 2 and 21 days. Early symptoms of the disease include fever, aches, pains and fatigue. Later, those infected can suffer from diarrhoea, vomiting and bleeding. It's a grim set of symptoms. Professor, what is it about this latest particular strain of Ebola that makes it so different?
Well, it's a different strain altogether, and it's different enough of a strain from the Zaire strain, the traditional strain that we normally see in the Democratic Republic of Congo on an annual basis, that we know that the vaccines are not reliable against this strain. It wasn't designed for this strain. The strain is quite different, and that's why and again, the infection properties seem that it's spreading much faster. We've contained previous Ebola outbreaks. We have Ebola outbreaks every year to some degree, but we haven't had a public health emergency international concern declaration for Ebola for quite a few years. And so I think that's the worrisome. It's very different, and it's seemingly spreading faster. And I think the lack of interest. This is the first year in which we have an Ebola outbreak in which there's very little international coordination. Again, lack of USAID presence that previously USAID would identify, has the infrastructure in place to identify infectious disease spread and start isolation and all these other contact tracing within 48 hours. We are now well over a week and a half behind, and because of the lack of the ground infrastructure that we used to have. And I think that's altogether very worrisome, especially since, and also coming up, we have the World Cup in about approximately a month or so. And if we don't get this contained, with all the World Cup travelers around the world traveling, it's going to be a nightmare. Any virus that, when you add in an enormous amount of international travel, whether it's World Cup or Olympics, it causes a certain degree of fear that if we don't control it in time.
So just to underline that, you think at this point, the way this is progressing, that an event like the World Cup, obviously tens of thousands of people coming to the US, this could be a serious factor, gathering that many people coming from all those different parts of the world with this current situation.
Yeah, if we don't get it contained. The good thing is, like, the transmission of Ebola is a much more severe virus, and it's not as readily airborne as, COVID or even hantavirus at all. And so theoretically, Ebola should be containable because it's such a faster progressing disease, 2 to 21 days, as opposed to 6 to 8 weeks for hantavirus, for example. And it's not as airborne. So we should be able to contain it, but we don't have the testing infrastructure. I think the U.S. just implemented travel bans for anyone who has been to Democratic Republic of Congo, Rwanda, or South Sudan in the last 21 days. But even then, the virus can travel beyond those 3 countries. And hopefully it doesn't become a super spreader at some point in the near future. But the fact that it's already killing a lot of healthcare workers when, healthcare workers have a lot of access to, healthcare and other testing is very worrisome. American doctor was also affected recently today in the Democratic Republic of Congo. So it seems to, spread to even those who should be able to contain it and identify symptoms of it, but they still got infected. That's what worries them. The speed of the spread is much faster than in the 2014 Ebola pandemic, for example.
A lot of what you've said falls really heavily on the non-expert ears. One of them I just want to talk about a little is that this strain of Ebola has no approved vaccines, which seems like the screaming headline straight off the bat. On the surface, that sounds extremely troubling. Is it?
Well, theoretically, there should be cross-reactivity. But, we've already vaccinated a lot of people against the previous Ebola strains, but clearly that's not slowing this one down. So obviously we could vaccinate more, but that involves a lot of testing, contact tracing. And then what we would do traditionally is once we find cases, we would do a ring vaccination of everyone in that community. That's how we stop smallpox. But the issue is the speed of deployment. We don't have that speed. The USAID used to be that speed of deployment. It would be in the locally in presence and actually give out medications and fund the local healthcare workers and medical clinics to do that, but that doesn't exist. The healthcare infrastructure to contain this is much more diminished now that USAID is gone. And I think this is clearly one of the examples of what happens when you decimate the healthcare infrastructure in a lot of these countries. So I'm worried about the speed of response. As we know, in an epidemic, the slow speed of response could yield to a much, much faster spread because containment and control is much, much reduced compared to what we used to have.
And I'm right that the other factor that makes that even more difficult, the speed of response, is that there is a lag time quite often between infection and diagnosis. Is that right?
Yeah. Now, Ebola's symptoms are much more severe, so it's much more clear that you have it. But by the time it shows up, the testing is not there. It's much more delayed. The containment, the tracing, the isolation, coordination, all this public health response takes a lot of coordination, a lot of logistical coordination. It's like it's like a disaster response, but you have to have the teams in place to do this. So, and the fact that it's the infrastructure to contain it is missing, that is what's worrisome, because the response is now so slow compared to what it is before. Now, WHO is obviously responding. That's why declaring the public health emergency an international concern. But even then, hopefully it's not too little too late, because WHO even recognizes we're much further behind than we had thought. And that's why they sounded the alarm when they realized that the virus is starting to get much more out of control than they originally thought it was localized.
I just want to hear from Jean-Jacques Muyembe Tamfum, a microbiologist, the microbiologist who discovered the Ebola virus vaccine to a different strain, talking about the current situation.
Le risque est très grand.
The risk is very high that the next pandemic will start from the Democratic Republic of Congo. There is a strong chance this will happen because our ecosystem is favorable to the development of various pathogens. But the problem, as I told you, is the weakness of surveillance. Our system is very weak at detecting an outbreak.
Now, after COVID, Eric, the word pandemic used by Jean-Jacques hits different for the public who lived through it. Remind us of the exact definition of the word pandemic and where we are on that journey this time around.
Well, pandemic is spread not just in multiple countries, which already have, but uncontrolled spread in multiple regions of the world as well. And so if this gets out of Central Africa, which right now is still in Central Africa, albeit in multiple countries in Central Africa, multiple communities and the cities there, if it gets beyond just regional and having community transmission spread in many countries and regions in the world, and it becomes significant enough beyond just a few, one or two handful of cases, then the WHO will declare a true pandemic. We haven't gotten there yet. Hopefully we won't get there, but this is why time is of the essence. We have to contain this before the World Cup, because the World Cup is one of those international gathering events where, again, tens of thousands, hundreds of thousands of people will travel and bring a lot of intermingling of pathogens. And this is where, testing years ago during the previous pandemic, our team developed one of the world's first contact tracing mobile apps for during the Ebola pandemic, but people laughed and it's like, why would we ever need to use this? So obviously when COVID hit, we now realized why contact tracing is so important. But in many ways, the lessons of COVID have fallen to the wayside. We haven't learned these lessons, and if anything, we have decimated our public health infrastructure since then. The lack of coordination between CDC and WHO, the decimation of USAID that used to provide thousands of healthcare workers directly with field training to contain this and do surveillance. They used to have a rule, 48 hours of detection or less, but now that's non-existent. That's where I'm really worried. I really hope we can contain this, and it takes coordination, and hopefully it will not reach pandemic levels before the World Cup, because that could really make it go pandemic.
Yeah, certainly the world has changed a lot since that pandemic, and we've entered a different funding world, if you like. You did point out that the Centers for Disease Control based in the United States have played a leading role previously, and USAID to any response. Do you get the feel for whether the funding cuts made are making this already much harder to deal with?
Yeah, I think so. And there's, the previous USAID directors have directly said this, like they're very worried about this Ebola pandemic, because as the previous inventor of the Ebola vaccine noted, like there's no surveillance in the Democratic Republic of Congo because they have no public health infrastructure. This is where the virus will just keep spreading, And unless you test, contain, without a vaccine, the main strategy is test quickly, contain quickly, quarantine quickly, isolate quickly. But without that requires an enormous amount of coordination, and we just don't have that. And I'm very worried. Like, I don't want to call that potentially this could go thermonuclear, but if we do not get our heads wrapped around this quickly and throw all of our resources, like true, like, massive military level groundswell of coordination by the WHO and local countries, this could really get very, very bad. Especially, again, we also have very limited treatment for this virus strain as well.
And as to who steps into the breach without that leading role from USAID, now that the WHO is labelling this a public health emergency of international concern, are you confident that the international community will mobilise enough to support, to deal with this emergency, that there are going to be people to fill that gap?
I hope they do. Like, they can send resources. That's, the public health emergency international concern alerts countries that potentially we need you to send resources to contain this. But, the U.S. under the Trump administration does not want to send resources to the WHO. They want nothing to do with the WHO, as you know. And the European Union, and basically it takes a lot of resources to be shipped in to do this. It's almost a military level operation that needs to be done to contain this, but these are very difficult. Some of these villages are very difficult to reach, and if it hits the major cities of Central Africa, I'm very worried. So I think I beseech all the country leaders out there to please listen and please send all the resources that you can to this response, because if it's lost out of control, it will affect their countries, even though many countries just think they can just sit on their hands. This will hit your shores, and it will be much worse. An ounce of prevention and resources sent to Central Africa now is worth a pound of cure.
Eric Feigl-Ding is an epidemiologist and chair of the Department of Public Health at the New England Complex Systems Institute in the US. It's been a pleasure. Thanks so much.
Thank you. Stay safe.
Right, the floor is yours. Let us know what you think, your concerns about the virus, whether authorities are doing all they can in Central Africa, in the US and around the world. And are you vigilant when it comes to contagions? All in your court now for discussion. I'm Anthony Howard in Berlin. For now, it's goodbye.